Welcome to Mahaska Health Medical Minute, where we will talk with your local trusted experts to bring important healthcare topics for you, your family, and our community. Today we'll be talking with Mahaska Health's Dr. Sean Richmond, family practice and obstetrics provider, who comes to us with years of experience and incredible knowledge about his field. He is passionate about helping patients and their families through each stage of life. So thank you, Dr. Richmond, for joining us today.
Yeah, thanks, Renee.
You know, just like all of us, we want to hear a little more about you and your current background and your current role here at Mahaska Health.
Sure. I grew up down the road in Tumwa, Iowa. Went to college at the University of Iowa. Got a degree in industrial engineering. Married at that time, and my wife and I moved down to Kansas City. I worked as an engineer for a short period of time and decided that I wanted to go into medicine. Her father was a OBGYN provider, so that was appealing to me. So I went to school at the University of Kansas Medical Center down there and graduated from medical school 1997. Did family practice residency. Really kind of debated between family practice and obstetrics. You know, those were my two things that I was most interested in. And I thought, well, with family practice, I can continue to do obstetrics and really do both. Finished residency in 2000, moved to Oskaloosa, Iowa in 2000. We wanted to be close to family. Both my family and my wife's family is down the road in Ottumwa, so our kids, we wanted them to have the opportunity to grow up near their grandparents and families. Oskaloosa had a great tradition of some wonderful family physicians. I just loved the community. It was close to home. I loved that it was a very family practice friendly community. People were just very, very friendly. A lot of them had a good history with family practice, well respected, family practice and doing obstetrics here. So I was able to come in and fairly soon got a good obstetrical practice started. Yeah, and been able to kind of carry on from there.
Wonderful.
Yeah.
Hospital side, you're surrounded by great staff. Community, what's your favorite part of the community?
Initially, I really enjoy golf, and we're blessed here in Oskaloosa with having 3 golf courses. So I played a lot of golf early on. I don't do that so much anymore, to be honest. But lots of opportunities for families, for kids. Kind of your small school, your kids can get involved in lots of different activities, which I was blessed with when I was growing up, and I wanted my kids to have that same opportunity.
Good.
Yeah, we have a wonderful community just as far as a lot of things going on down around the square, all the time. My wife and I, we met lots of young couples at that time when we were still young, I guess, that had young children as well. And, we felt like we had a life outside of my professional life
Sure.
as well. So we enjoy boating and camping and doing things with friends.
Good.
And enjoy lots of activities that are offered here in Oskaloosa.
So you've been here for 20 plus years. I know your patients. Personally, when I talk to them, they feel very, very well cared for. The compliments of just the care you give them and the listening when you visit with them in the office. And they're just so proud to have you as their provider. So that's pretty exciting. Second of all, you get to deliver babies.
Yeah.
How exciting is that? Talk about where that has brought you in your field and what you're the most excited about moving forward with that.
Yeah. Medicine, in general, it's very rewarding, right? You develop relationships with people and that's great. But, getting that immediate kind of rush of adrenaline, when you deliver a baby, you really get that, okay? You kind of have that immediate feedback. You see this baby come out and you get to hold it for the first time and hear the baby cry for the first time, and you've gotten to know the parents well over the preceding, 9 months, and
well, it probably feels like a privilege.
Well,
every
it does,
time.
yeah.
Sure.
You kind of feel like you're part of their family, to be honest with you, and it's just a wonderful experience, and you really get that. I guess just kind of adrenaline rush, when you deliver a baby, and there's nothing more rewarding.
Well, and then you get to see firsthand families growing. How many have you seen go through each stage of life?
So I delivered my first baby here in 2000. And so, that child is now 20 years old, okay? So and for many families I've delivered, several, 3, 4, 5, of their children, okay?
Sure.
So that's been a lot of fun to watch their families grow, watch the kids grow,
Rewarding.
See them enact. Yeah, very, very rewarding. See them out in the community, see them at sporting events or whatever activities they participate in. I try to get out and about and watch a lot of those different things going on around the community. So
Sure.
yeah, it's just it makes you feel kind of warm and fuzzy inside when you're able to see those kids that you delivered, and now they're becoming young adults themselves.
Yeah. So what advice would you have for women who are going through those stages? What is your top thought of keeping new moms and women active and keeping them going, as hard as it is? I'm sure in the clinic you talk about they need to take care of themselves and they need to stay healthy, but what really advice do you give that mom that comes in?
Well, a lot of times I'm meeting, when I first meet them, I guess a lot of times it is just they got a positive pregnancy test. They may be in their fairly young adult life, just getting started. Maybe they've acquainted with me beforehand, but maybe not. So now if I see them beforehand, before they're pregnant, they kind of develop a relationship with them, and I'll tell all women of childbearing age just to take a prenatal vitamin. You don't know when the time might come. It's good for you just to take that. Recommend all the normal healthy lifestyle type stuff. Exercise regularly, watch your diet, get good sleep, all those things that are important for everyone, but yeah, very important for young people, young women in particular that are thinking about getting pregnant or starting a family.
Well, and the dads are coming in.
Yeah.
I mean, so you're talking to them too. I mean, they need to stay healthy and active,
exactly.
and to be able to take care of their families.
Yeah,
so.
yeah, and men are a little more resistant sometimes. The women will come. I think you get the women into the clinic, because of obstetrical care, perhaps, or they need they're better about coming in for their annual exams. Really, women do a better job of that than what young men do, and I'm just as guilty, to be honest with you. But yeah, you do get an opportunity to develop a relationship with them. What I'll see a lot of times is some of the fathers. I'll get to know them. They come to a lot of appointments. I love it the first time, the first pregnancy, if you will, and the father's in there for every appointment. And you can just see the excitement with them, and that really is awesome. And then what you'll see is sometime down the road they'll say, well, I'm kind of getting to that age where maybe I need to come in too. Okay, so yeah, you'll get established with them, and yeah, very, very rewarding, obviously.
It's a nice full circle, isn't it?
It is.
And you can collaborate with them just in every aspect.
Yeah.
And you get it, and you understand where they're coming from. You're living in their community. You understand if there's any obstacles in their life, and that's a pretty neat story.
It really is. And I'll think back when I see the young fathers to myself, and I remember going to all my wife's appointments with our firstborn, and the same excitement that you had, and kind of that unknown, and that, oh gosh, what do we get ourselves into type of a feeling, and stuff. But it's it's a lot of fun to see that, and the feelings that he's going through and so forth. So yeah, a lot of fun. Some
exciting news moving forward, new OB doctors.
Very exciting. Yeah. So I still love doing OB, but probably going to gradually kind of slow down here with time, and I think the timing's right. But again, for my patients that are out there listening to this, no, I'm not demanding it yet. I'm still going to do OB for several more years still. But no, this year, 2021, we have 4 new OB providers coming on. And I've met all 4 of them. They're all great people, first of all. I think the community can really feel confident. Most of them have very small town values, kind of grew up around here or in another small town. So I think they know what the population of people they're going to be caring for is going to be like. One of them is very experienced. She's actually been in training. Well, she finished her training probably close to 10 years ago. She did an OB fellowship. Her name's Dr. Patricia Milner. She is now practicing in Hawaii. So we're getting somebody to come from Hawaii, here to Iowa. But no, she has lots of experience. Going to be outstanding. And then the other 3 will be finishing up residency training this summer. Two of them have roots or family nearby. Okay, so Dr. Preston Serig, he grew up here in Oskaloosa. I still remember doing his athletic physical when he was in high school. Okay, so really excited about Dr. Serig coming. And Dr. Hannah Thompson, her husband grew up here. Her husband played soccer with my son back for Oskaloosa High School. So her husband actually works here at MH right now. But Dr. Hannah is just a wonderful person. And then Dr. Eric Wood. So Dr. Wood is close to my age. So he actually, his first career was in education. I believe he was a principal, and then decided to go into medicine. And so he has a family already. That's some of his family's already grown and out of the house. But just a wonderful person, really nice personality, very easy to talk to. All of them are just really easy to talk to. And yeah, that's really exciting for us. MH, to have those 4 providers coming on, and you just know that they're going to hit the ground running. They're going to care for people, in a great way. They're going to provide great care. And
sounds like a very welcoming change on your end.
Yeah. It is. Right now there's myself and Dr. Goodajon, that are providing obstetrical care here, and Dr. Goodajon's awesome as well. She's going to continue to practice as well. So yeah, we'll have 6 of us now. So good. The call schedule will be much easier on us. Let's put it that way.
Well, I'm sure you're very much looking forward to that.
I am.
I'm sure Dr. Goodajon is also.
Yeah, I believe so. Yes.
Just a quick, what's your favorite success story? And maybe not necessarily success story, but what's your overall? You've talked about delivering the babies and the joy you see in that. Maybe in your family practice, what makes you feel the most fulfilled at the end of the day?
Well, first when you ask for my success story or my favorite success story, I guess I would personalize that, and it just probably comes down to my family, and my kids. And very proud of my kids. And my youngest graduated last year, so she's in her first year of college right now. So we're empty nesters to a certain degree, although my middle one is still taking some classes here and living at home. So I'm trying to keep her as long as I can. but no, I'm very proud of my family, my children in particular.
It sounds like you raised them in an environment you wanted.
Yeah, it was easy. We had lots of people that were helping out, I guess, to be honest, and they all had great friends, and the community made it easy on my wife and I. But a shout out to my wife, because she's done, it's not always easy, I think, being the spouse of a person who's doing obstetrics, because I get called out at lots of hours of the night, and when the kids would be doing activities and stuff, sometimes I'd have to excuse myself, and be gone for a little bit. So she's done a wonderful job too. But from a professional standpoint, just the generic answer probably, but it is very important to me, of just the relationships that I've developed, with people, in all honesty. That's probably the thing I'm most proud of, is when I see people out at Walmart or the grocery store or on the square in activity, and the kids come up, and they're excited to see me, and that's very meaningful to me. Yeah.
Well, shout out to your clinical staff. I know Tammy is always more than willing to help if I have a question with one of your patients. I know you guys start early, you end late. You collaborate across the board, across the hospital, surgery, with me in the cardiac side, ER. I see your name. Really across all service lines. That's a true statement to what you do for us here at Mahaska Health, and I know it's just completely an honor to have your patients, and they are honored to be your patient. And sometimes it's nice to be reminded of that.
Yeah, well,
and
appreciate that,
it is, and we hear it daily, and your patients love you. So thanks for joining us today.
Yeah, well, thank you so much.
Mahaska Health is dedicated to caring for you. We have a team of experts putting everything they have into your health and getting you back to what matters most. Same-day appointments are available, and our walk-in is open 7 a.m. to 7 p.m. Monday through Friday, 8 a.m. to 4 p.m. Saturday and Sunday. Our telephone number is 672-3100, and feel free to visit our website, mahaskahealth.org, for up-to-date information.